We're here at the Lowe's Hotel in South Beach, and I'm in the speaker ready room because I'm faculty. Social media standards are playing a part in how these patients think and what their desired results are. There is a heightened awareness of asymmetry, so much so that I have a lot of younger patients, millennials, Gen D, asking for one side surgery only because they think the other is completely normal. Good morning. I'm back from Global Aesthetics Conference 2024 in Miami. We had a great time. I was able to catch up with some great friends and colleagues, mentors. I even met a few new faces and even some celebrities. I was a little bit starstruck, to be honest. But first things first, the lectures went very well. So I was there Thursday morning to give 2 lectures, one about upper blepharoplasty and how it's not an old Caucasian female surgery anymore, how even young people are coming for upper eyelid rejuvenation. These are 6 of my patients. None of them are above the age of 40. Now in training, I almost never had an upper blepharoplasty case from my attendings who was under 50. But here they are. And it's, I think, because of social media largely. It was received very well, and I got a lot of good feedback. The second lecture that I gave was about correcting the high unnatural Asian westernized upper eyelid, which I've had to do for some patients. This is a 38-year-old female who came to me in early 2022 who said, I don't want to wear tape anymore. And that's a common complaint that I hear. As you can see, there is absolutely no line, incision, or fold along her upper eyelid. And so I have to make one for her. And so that was also received very well. I got a little feedback from the master himself, Dr. Guy Massery. If you don't know, he's an oculoplastic surgeon out in Beverly Hills, California. And a lot of colleagues, including myself, have learned a great deal from his education in the form of video content as well as face-to-face feedback. So that was really, really helpful and insightful. And it's great that we can give each other feedback and challenge each other, challenge ourselves, really to elevate our game so that we can provide the best aesthetic plastic surgery results for our beautiful patients. One of the other celebrities I met along the way was Dr. Anthony Yoon. He's a very big inspiration for me, and I had never met him before, but I really love his witty, humorous, really intellectual content all over social media. As you know, he's quite big on YouTube. He's America's holistic plastic surgeon, and the message that he has, the wit with which he does it is really admirable. And I think it's very inspirational that he is also Korean American. And so as a Korean American myself, it's a very big inspiration that someone who has my skin tone, has, you know, some of the same background as I do, is killing it out in the real world. So I didn't geek too hard, and I just kind of walked with him and said 안녕하세요, which is a formal hello in Korean. And I just said I appreciate that he is doing great work and advancing our specialty in such a huge and unique way. So I may have mentioned this before, but in terms of conferences for plastic surgery, this one's kind of unique in that there are multiple specialties that are invited as guests, as speakers, and as attendees. So there's quite a range of specialties who are represented. People like me, we are facial plastic surgeons. So we train in head and neck surgery, then go into facial plastic surgery only. There are people along the lines of general plastic surgery. So from head to toe, they learn plastic surgery throughout their training and are proficient in plastic surgery for the entire body, as well as the face and neck. And then we have derm, and then we have oculoplastics. Oculoplastic surgeons, obviously, you know, their bread and butter is right here in the brow and eyelids. So it's really good to hear different perspectives from all different specialties. I was really focused on meeting with other surgeons and also gaining some knowledge and feedback about practice management. As you know, our practice is growing and expanding, and so the other area that I really wanted to focus on was the practice management area. And so there are a lot of different aspects of owning and running a medical business, especially in the realm of aesthetic and plastic surgery. where there are a lot of considerations going into cultivating a business, growing a business. You can't just hang up a shingle anymore and just wait for the next person to come. It's really, how do you differentiate yourself? How do you present yourself as the authority for your patients to help achieve the most beautiful version of themselves? We learned a lot, and I'm looking forward to implementing these things and bringing you the ultimate patient experience moving forward. As you probably have seen in our previous postings, we got keys for a new, bigger space, and we're planning it out, and we hope to have it ready for you, hopefully sooner rather than later. My guess is sometime mid to late next year that we're going to have a grand opening ceremony and a wonderful party to commemorate this next chapter of the You Are Beautiful Aesthetic Institute. So I'm really excited for that. And I have a couple shout outs. First to Dr. Dave Sherris. Dr. David Sherris is my residency chairman, a good mentor and friend from my years in Buffalo as a resident and as a medical student. He is more than gracious with his knowledge and his wisdom, and so a huge thank you for that. Thank you to many of the colleagues who I reconnected with and even met for the first time, especially Dr. Sid Starkman. So Dr. Starkman and I were residents in Buffalo, and he's out in Scottsdale, and he's doing a great job making the world a more beautiful place. I also got a chance to meet with some people who represent companies who help businesses like us, and so shout out to them. Some of them we're already working with. Some of them we look forward to working with at some point in our journey to advance the You Are Beautiful Aesthetic Institute. My only regret is that I wish I had a little more time in the sun, but again, the schedule was really jam-packed, and meeting people, reconnecting, and learning new things, and reinforcing established techniques of surgery and of aesthetic medicine, it was really a great time. So I look forward to implementing all these things and to make the patient experience even better than before. And again, I want to end with our 3 core tenets. You are beautiful, you are unique, and you are worth it. Stay tuned for great things to come at the You Are Beautiful Aesthetic Institute. And with that, I'm signing off. Global Aesthetics Conference 2024 in Miami.